Okay, I think we will go ahead and get started. So I'll pass it over to Reese, and if folks want to keep introducing themselves, that would be great.
Hello, good afternoon, everyone, and thank you so much for joining our webinar today on Toolkit on Municipal Extreme Heat and Air Quality Preparedness in Connecticut. So let's get started because we have a lot of fun things to get into and tell you all about. So first, we want to do introductions. And so I am Reese Pauling. I'm from Washington, D.C. I am a first year Master's of Environmental Management student here at the Yale School of the Environment. And so my focus, or what we like to call here is our specialization, is people, equity, and the environment, and also urban sustainability. So some of the work I've done in the past is working with inner city youth on environmental education programs, working with the Department of Energy and Environment in DC on combating urban heat island effects and also stormwater management initiatives, and then also working with some green roof companies with installing green roofs in major buildings within the district. So I'm excited to be here and excited to tell you a little bit more about our template today.
Oh, I guess I'm next, but I'm Jen Wong. I'm the faculty supervisor for this small but mighty student team that I had the honor and the pleasure of working with this semester. I'm the executive director of the Yale Center on Climate Change and Health, and I'm based in Glastonbury. I'm really happy to see everyone here. I see some familiar faces, but also lots of new folks, and we're really happy to have you and connect with you. Over to Senna.
Hi, I'm Senna Weiser. I am also a first-year Master's of Environmental Management student at Yale School of the Environment, and I'm specializing in people, equity, and the environment as well, and also climate change science and solutions. I'm originally from Mansfield, Connecticut, and my past work was largely focused on climate action in Connecticut. I did some work around legislation, including climate education in the state, and then also spent a couple of years in DC working on regional climate issues. But really excited to be here and to get to talk with you all about this topic. Pass it back to Reese.
Awesome. So thank you again, everyone who is joining us from far and near today. Just to take you quickly through our webinar agenda. First, we'll go over introduction of the project, and then we'll introduce key aspects and highlights of the template on municipal extreme heat and air quality preparedness. This is a 70-page document that has been edited and revised by Senna Weiser and myself this year during our clinic in climate justice and public health course offered by Jennifer Wang, the executive director of the Yale Center for Climate Change and Health, also known as YCCCH. And so additionally, Center Weiser and I, along with the help of YCCCH and a web content producer, has created a website for the template to exist and be of a source in the future for public health departments addressing extreme heat and air quality preparedness. So we will also take you through that website and what it looks like. Lastly, we will go over some future considerations of this project, highlighting feedback from our local health departments through a focus group that we've had. And with having a little bit of time left, we'll answer some questions that you all have submitted with your registration and any that may pop up within the chat in the Q&A section. So we will be eyeballing that throughout the webinar. But first, I will like to welcome Jennifer Wang, who you've had an introduction by, who was our advisor on this project this semester and director of the Yale Center for Climate Change and Health, to say a few words on the project before we dive deeper in today's presentation.
Thanks, Reese. So I just wanted to give a little bit of context about where this all came from. And the purpose really of this toolkit is to serve as a guiding resource, with the primary audience being local health departments in Connecticut, including but not limited to those that are receiving pilot grants from the Department of Public Health, from the state, for their local heat and air quality preparedness and response planning. There are only 4 pilot grants available through our CDC funded projects. So we realize that there's more than 60 health departments around the state. And we really wanted to be able to take this template and toolkit and really get it out there so that other local health departments or districts can try to, adapt it and modify it and use it for their own work, within the absence of, having the pilot grants available for everyone. It is meant to be a living document. So it was actually the skeleton of it. The initial early drafts were actually developed a couple of years ago. And we have not had the capacity to really roll it out until now. So we recognize that it has been a work in progress. It's been updated and revamped for 2024. So there's a lot of really great work happening around the country in recent years that's been incorporated. And yet we know that this is a really active area of interest for health departments and other, government and non-governmental entities. So we know that there's great work happening here in Connecticut already. We have the pilot grants starting to get underway. So all of that is to say that we know that we will continue to learn and iterate on this tool. And we welcome all of you here and other colleagues to give us feedback, test it out, see if what works, what doesn't, and we will kind of roll out a version 2.0. My goal is to kind of have it updated periodically as, new resources come in. It was developed based on an examination of over 20 extreme heat and air quality response plans across the US, including municipalities, in some cases, county governments in California, Maine, Connecticut, Colorado, and elsewhere. So it's really trying to pull together some of the best pieces and the best practices from other places, while also giving it a really unique Connecticut angle based on our climate here and the way that our governments are structured, which is with 169 towns, like 60-something health districts, different environmental management districts, no formal county governments. And so we kind of needed a different tool that can be adaptable in all of these different jurisdictions. We have some wonderful partners in this work. The Connecticut Department of Public Health is our primary partner in this work, and through the CDPH, we've been organizing this Connecticut Climate and Health Equity Coalition. I'll throw in a link to that later in the webinar. And then they're not formally partners, but they've been very helpful in this process, which is staff from various local health departments in the state who are part of the coalition or who are not, but provide us some really valuable feedback in some of the earlier stages of this work. So we appreciate you all. And all of this work is supported by the Climate Ready States and Cities Initiative grant from the CDC to implement what's called the BRACE framework, which stands for Building Resilience Against Climate Effects, which is a CDC devised framework that can be adapted in a lot of different parts of the country, and through these grantees around the country. Connecticut is one of 11 currently supported by that grant. So I hope that provides some helpful context, and back to Senna and Reese.
Thank you so much, Jen, for that. Okay, so let's get a little more into the template. So again, like Jen was saying as well, this template serves as a living document based upon the analysis and synthesis of about 20 different extreme heat and air quality response plans across the US. And like Jen was saying, some including California, Colorado, and even areas in the Connecticut area. Key aspects that this template is in response to is extreme heat, which is defined as a long period of 2 to 3 days of high heat and humidity with temperatures above 90 degrees. We also go over impaired air quality, which is when the air quality index, or AQI, is above 100 with contributors of particulate matter 2.5 and ground level ozone. We also touch within the template on indoor air quality in vulnerable populations. The focus of this template is on local preparedness and response to extreme heat, PM 2.5, and elevated ground level ozone conditions. And according to the US Environmental Protection Agency, the 10 warmest years on record have occurred within the past decade, from about 2014 to 2023. Temperatures are expected to continue rising, and hot days can increase the amount of ozone at ground level. And so additionally, socially vulnerable groups typically live in industrial or urban areas experiencing high levels of air pollution and extreme heat, making them more vulnerable to heat related illnesses, raising public health concerns. And so these vulnerable populations include low-income households, communities of color, elderly individuals, children, unhoused individuals, individuals of occupations outdoors, and those experiencing underlying respiratory issues. These vulnerable populations, is important to note, are determined by both social and systemic barriers in which each municipality may be facing with their unique areas and population that they may be serving. And so I do also want to highlight that while our template addresses and acknowledges these vulnerable populations that we've identified here, there are many different groups that are still sometimes overlooked in the conversation of extreme heat and air quality, and one group being those experiencing severe mental illness. And I do want to plug in another student working group from our course this semester that has worked with a psychiatrist at the Connecticut Mental Health Center on understanding how people with SMI cope with extreme heat. And so that work is very, very important. And more on that with like our future considerations and the purpose of this template being that living document that we want it to be. And so therefore, this template serves as an important guiding source for municipalities to adapt their operations to reflect the prioritization of the health and well-being of their residents, especially those most vulnerable to these co-occurring consequences of climate change. This template not only addresses actions taken to prepare for and respond to extreme heat and air quality alerts, but also reviews municipality level climate adaptation commitments and strategies. And so this year within the template, Senna Wazer and myself expanded upon these 4 important criteria that you see here on the screen. And one in particular are the interactions with other impacts such as indoor air quality, which is something that wasn't in the original template and that we wanted to really emphasize and add on to for this version of the template this year. And so next, I'll pass it on to Senna, who will explain why all of this is important, of course, but especially within the Connecticut area.
Yeah, thank you so much, Reese. So with Reese's framing on the scope of the toolkit, I want to take a moment to address why this toolkit is particularly important right now, and also in Connecticut specifically. So as we all know, as climate change continues to worsen, so does the impact of extreme heat. And the Northeast is one of the fastest warming regions of the United States, which the graphic on the right demonstrates, along with changes in annual precipitation. And this graphic also displays how this is true across seasons, with annual, summer, and winter temperatures all increasing. And heat is an incredibly dangerous impact of climate change and was responsible for over 2,300 deaths in the United States in 2023. And as Reese was mentioning, it also disproportionately impacts vulnerable populations, which include those experiencing homelessness, children, the elderly, those without air conditioning, and also those living in communities that are more vulnerable to the urban heat island effect, which includes many of Connecticut's cities. And for those who might be unfamiliar, the urban heat island effect is when urban areas experience significantly higher temperatures than more rural areas because of lack of tree and vegetative cover. And this can also affect particular neighborhoods within cities that might, for example, have fewer trees and less green space and more pavement, buildings, and other heat-absorbing surfaces. In addition to heat being really dangerous on its own, it is also positively correlated with both ozone and PM 2.5. And specifically, ozone production is accelerated by extreme heat, and the time of year with the highest PM 2.5 concentrations in Connecticut overlap with summers and higher temperatures and ozone concentrations. In addition to that, outdoor air pollution from ozone and PM 2.5 pollution are both largely produced by vehicle exhaust and industrial activities, which disproportionately impact communities that, for example, have highways running near or through them, or are located near polluting facilities such as gas power plants. And it's also really important to note here that the increasing issues Connecticut faces in regard to PM 2.5 are largely tied to wildfire smoke from Canada and the Western United States, which is impacting the Northeast as we've seen over the past few years. And both of these pollutants are really bad for public health. Connecticut already faces incredibly high rates of asthma and other respiratory diseases. And so worsening air quality conditions are extremely dangerous to Connecticut residents, especially those with pre-existing conditions. And I also think it's important to note here that there are significant racial disparities in who is most impacted by asthma in Connecticut, with Black and Hispanic residents facing significantly higher rates of asthma than white residents. And so because of the correlation between extreme heat, ozone, and PM 2.5, as well as the worsening impacts that they're having, the preparedness template addresses all three simultaneously and also takes into consideration how they interact with one another to affect public health. And it really specifically targets those concerns to the local level and specifically to local health departments, because as these impacts worsen, it will be critical for every level of government to take action so that we can ensure that people, communities, and public health are as protected as possible. And action at the local level, including from public health departments, will be a really critical part of that. And so with that, I will pass it back to Reese to start talking through the actual template.
Thank you, Sana. So here next we have our stakeholder roles and responsibilities. And so in this template, we wanted to specifically identify the importance of these roles and responsibilities by stakeholders and clearly state what those are and what they look like. And so all stakeholders play an active role in supporting a specific municipality and also the broader state of Connecticut in adapting and responding to extreme heat, PM 2.5, and ground level ozone pollution. So some of the major stakeholders that we identified within the toolkit are these main four, and that being federal government, which serves as the main weather tracker and notifier of harmful weather conditions, triggering state and local actions accordingly. And here on the right, we have an example of who would be considered federal government stakeholders here. And then next, we have the state government who routinely monitors weather conditions like extreme heat, in which the governor's office, for example, will be contacted about, and then actions such as issuing notices to towns, requesting towns to submit information regarding cooling centers, cooling center operations, and deploying social media alerts on a state level is really, really important for this role. And then additionally, local government, such as the mayor's office and our local health departments, is next. In a given municipality, will serve as primary initiators and coordinators of this template that we're going through. So lastly, our community-based orgs, non-governmental organizations, and local services like churches and senior centers will play a key supporting role to local governments in their service provisions and operational plans. And this particular role, again, when we're talking about this being a living document, and from the version before to now, this was something that Sid and I added within the template because we found it very helpful to put in the importance of community engagement as well and community organizations that should be in conversation with all of these stakeholders as well. And I'm gonna pass it back to Senna.
Amazing. So the next section of the template addresses different activation phases and activities within each. And it also addresses some stakeholders who should be involved in each task, which we'll go through in a minute. And we identify 5 activation phases within the template, which are pre-seasonal, seasonal, heat emergency, air quality event, and post-event. And the example screenshot that is included here is from the heat emergency activation phase. And as you can see on the far left, it includes a specific task, if you don't mind hitting next, Reese. And so an example from this column would be boosting public communication materials on safety and proactive measures during periods of extreme heat. And then the 3 columns in the middle indicate whether this action should be taken by the Office of Emergency Management, the Health Department, the Mayor's Office, or multiple of them. And then the final column on the right includes space for other relevant partners who should be involved with taking action, such as in this example, public libraries, parks and public works, and direct service organizations, among others. And we hope that by providing these different tasks and activation activities within each phase, it will provide municipalities and local health departments with a structure that they can use to make decisions during different extreme events, while also preparing ahead of time. And I think it's also important to mention here that while we provide a number of recommended activities that will hopefully be translatable across urban, suburban, and rural settings and locations, these recommendations are also a starting point from which local health departments will hopefully customize the plan to meet the specific needs of their residents. Next slide. So I also want to take a few minutes to quickly review 3 other action-oriented pieces of the template that we hope will really supplement the sections on stakeholders and activation phases. And so the first piece of that is around plan maintenance. And this section provides recommendations for the local health department in charge of the plan and its annual review and updates. And it includes sections on gathering stakeholder feedback and reviewing resources. And the idea here is really that we hope this plan will continue to change and grow and be updated as specific municipalities learn what action and resources are most needed in their communities. And also as the threat of extreme heat and poor air quality events continue to shift and likely grow with climate change. The next section is focused on climate change resilience and really recognizing that while responding to severe events is critical for protecting public health, it is also really important to reduce the factors that lead these events to be as severe as they are, especially for vulnerable communities. And so this section includes both short and long-term strategies. And an example of a short-term strategy might be ensuring the proper functioning of water systems or expanding tree canopy, especially in neighborhoods prone to the urban heat island effect. While in contrast, a long-term strategy might look like improving bicycle infrastructure and making the municipality more walkable to reduce vehicle emissions, or increasing educational programs regarding indoor appliances and energy efficiency so that the baseline indoor air pollution is reduced along with outdoor air pollution. And then the final section is around communication strategies, both internally with partners such as community-based organizations, but also externally with the general public in considering different materials that can be used to do this external communication, including flyers, fact sheets, and social media messaging, which we will actually talk about more in the next section. So in addition to the template, one of the other pieces of the project that we've been working on is ensuring that this information is easily accessible to those who want access to it. And this material is, of course, targeted towards local health departments and municipal governments, but this way we hope it will also be accessible to community members and others who might be interested. So I am going to take a moment here to drop the link in the chat. But yeah, we also, in addition to making sure it's accessible, we wanted to ensure that there was the ability to continue updating materials as additional work is done, particularly by the Yale Center for Climate Change and Health, as well as other partners. And so we put together this website, which I just dropped the link for in the chat, and it's hosted by the Yale Center on Climate Change and Health. And there are a couple of key things that the website will help us to do. So the first is to ensure easy access to the template, and folks can download and customize it whenever is convenient for them. So it's on there now if you want to take a look at it. In addition to that, there are some resources that are not included in the template, but we still thought could be really useful to local health departments as they're putting together their plan, specifically around communicating with the public, and I'll go a little bit more into that on the next slide. And finally, having these materials shared in website form, of course, allows them to continue being updated as time goes on. And Reese and Jen will speak to this more shortly, but this was an important consideration, recognizing that all of this work is ongoing. And we received a lot of really incredible feedback over the course of the semester, and some of it, such as feedback from the Connecticut Climate, Health, and Equity Coalition, we were able to incorporate, while other feedback that we received more recently or was outside of the scope of the work that we're doing this semester, we didn't have the opportunity to incorporate yet, but is still really important and valuable for future work and considerations. So with that, let's get a little more into the website. The website has 5 pages, the first of which is just a landing page with some background information on the toolkit and the project. The next page is focused on the template. So it includes a downloadable and editable version of the template, which will hopefully make it really easy to access. But it also includes examples of different types of extreme heat and air quality preparedness plans from different levels. From the city level with an example from New Haven, to the state level with resources from Connecticut and Massachusetts, to the federal level with resources from the EPA and CDC. And hopefully all of these resources can be used to supplement the materials and information found within the template that we've helped to create. The next page is really important because it provides additional resources that didn't fit within the template itself, but are important specifically when thinking about public communication. So this page provides a compilation of infographics and resources that can be used for public communication, including on different topics and for different moments in time, depending on whether it contains general information, preparatory information, or information for during an extreme heat or air quality event. And it also includes a section on additional considerations that should be taken when communicating about either extreme heat or air quality, including for different vulnerable populations. And following this webinar, there will also be a page with the recording of the webinar as well as our slides. So if there's anyone you know who missed it but would be interested, they're welcome to check that out. And then finally, we've included a contact page so that folks can continue reaching out and receiving support as we hope local health departments begin implementing these plans. And with that, I will pass it back to Reese for future considerations.
Technical difficulties. There we go. All right, so as we're, starting to close out, we do want to bring up some future considerations and things that we've been getting some feedback on from specifically our focus group. And so early this semester, we were able to host a focus group with local health departments from about 5 areas in Connecticut who provided feedback on our toolkit. It was extremely helpful in revising and editing key components of what we have presented to you today as the final version. And so during this focus group, we've asked 4 questions related to local health departments' reactions to the template that we're showing you now, but in draft form, okay? And so through qualitative research methods, Senna and myself used transcribed audio to code the feedback from the group discussion, which resulted in about 4 key themes and domains. And those are what you see here on your screen. One of the themes being supports, the other being actionability, community concerns, and collaboration. And so we have incorporated most of this feedback into this final version that you see today. However, some feedback was outside of the scope of this project for this semester, but still very valuable for future considerations, and we want to note that. So some including the importance of evaluating the effectiveness of messaging. That was very important, and we definitely heard that from our focus group, because when we're talking about posting these infographics and making sure people are aware of extreme heat and air quality changes, that yeah, we may be posting it, but is it effective? Are people actually using it as a source? And so having that question about evaluating the way it's being posted was very key. So we want to thank those in the focus group who brought that up. Additionally, addressing injustices of highway communities and increased air pollution. Like we said, there are many different vulnerable populations, and also with different municipalities, there are different areas with different locations. And so some areas that are located near major highways will definitely have more air pollution problems in comparison to areas that are not located by major highways. So that was something that we didn't even it didn't even cross our mind. So that was another great point that was brought up. And then lastly, funding allocation concerns. So trying to understand that there is limited funding at times, and when there is limited funding, how and when do we prioritize this initiative over that one, or this project over the other? And that's again concerns that are important and should be in the next version as well. And so in addition to just this small screenshot of what our themes ended up being from the focus group, there's of course many more parts where people have been giving us great feedback, but we also wanted to highlight some example responses as well, with one being, it would be helpful for LHDs to have a cadence for when different actions should be taken, including pre-scripted messages, which we was like, yeah, that is very true. And then also schools look to public health departments for advice on how to go about activities and emergency announcements during extreme heat emergencies. So again, great things that were brought up in the focus group. And with time permitting with the rest of our semester, we wanted to highlight that and say that that should be something that's on the top of our list for, future considerations. Additionally, we would also like to highlight, this is what I was saying earlier in the beginning of the webinar, highlight another student working group that is adjacent to the work we have done this year, or this semester, and we hope that in the future there could be a space for collaboration with other student working groups within Jen's course. And this group worked in particularly with a psychiatrist at the Connecticut Mental Health Center to conduct interviews in the New Haven area with people with severe mental illness, coping with extreme heat and or electricity disconnection. And so this will widen our own scope of focus within vulnerable population and also plays a huge role in a municipality service area and population of who they should be thinking about in terms of different groups. And so now I will pass it on to Jen for a few closing words and opportunities to engage with the template in the future.
Thank you so much. So yeah, this is it's kind of a culmination of the semester-long work and some other work that have been done in the past, and it's also just the beginning. So like I said earlier, we welcome your feedback anytime. Feel free to poke around in it, test it out, check out the infographics. Those are all available on the website. And email me, the students like Reese and Senna, you can reach them as well, but they are moving on to, the next semester. So I will work with them if there's anything that they can help address. And I will be kind of the staff sort of like being the through line and continuing this work after this semester. Periodic updates, we'll have that posted on the website. And when I mean just the beginning, I don't mean also just the beginning with the toolkit, but also in terms of the climate and health work in Connecticut broadly. I think a lot of us in academia or in like nonprofits like PACE, Mark's been making a lot of comments, and all of the health districts and health departments that are represented. I think there's a lot of work that has been going on, but it might not be called climate change and health, or you might have gotten questions around how to deal with, say, the wildfire smoke episodes last summer. And so I think we've all been kind of doing it in some way or another, but not necessarily always with a clear plan in place. And sometimes just kind of finding what we can in the moment. And so that is all starting to come together more. I know that there's more and more interest in it. I know that the State Department of Public Health has an Office of Climate and Health that's been working on this, offering and developing future trainings that will be launched. Connecticut Association of Directors of Health has also been really active and interested in this work. So this field is starting to come together, and I would encourage everyone to save the date for our second annual Connecticut Symposium on Climate Change and Health, which is going to be a half-day in-person meeting at Southern Connecticut State University in New Haven. And we are going to be talking about the latest science around climate change and health impacts in Connecticut, as well as showcasing solutions from around the state. Like I said, I know many people are working on this, even if you're not calling it that necessarily. And we really are interested in highlighting what is already happening, so that we can all learn from each other. So if you're interested in that, please let me know. If you have something really cool that's going on, just reach out to me. I'd be happy to see if we can work you into the program. We're actively developing the program. And since you all registered, I will be making sure you get notice once registration opens for that symposium. And also we have this Climate and Health Equity Coalition, which is spearheaded by the Office of Climate and Health at DPH. We meet quarterly. I think it's usually like a second or third, don't quote me. I think it's the third Wednesday. It's on the website, which I linked here. There's a whole meeting schedule. There's slides and recordings from previous meetings. So the next one is on January 15th from 10:30 to noon, and it is virtual. So these are all just opportunities to kind of be part of the conversation. And then besides those two kind of like convening type opportunities, there's also going to be some training. There is training that is in the works through DPH around climate change and health, and that will be rolling out sometime middle of next year. So there's a lot of potential resources, and then my tiny office here at the Yale Center, Climate Change and Health, we have access to experts at Yale, other universities around Connecticut that are doing this work. We'd be happy to take questions, help connect you with other potential partners in anything that you would like to do. So it's a small but growing community, and we would be really happy to have you be part of it. And yes, thank you, Senna and Aniela, for asking the question around the coalition.
And before we go into our Q&A, we do want to do a few thank yous and acknowledgements. Within this project this semester, our main partners were the Yale Center on Climate Change and Health and also the Connecticut Department of Public Health. So thank you for being our project partners as we were going through this. We also would love to thank those who attended our focus group this semester and giving us very valuable feedback on the template and things to consider for the future. So that includes local health department staff from Milford, Norwalk, Bridgeport, Ledge Light Health District, and East Shore District Health Department. Thank you all so much. Like, that was valuable information. And the Connecticut Association of Directors of Health has helped get that word out that we were doing a focus group, and we were able to get a lot of people that we didn't think we would have a lot of numbers. So thank you so much. We would also like to send our thanks to Annie Harper, assistant professor at the Yale School of Medicine, who assisted us with our qualitative analysis portion with the focus group and putting it together in themes and understanding how to read back what information we were getting. And then also Ren Dunleavy, the web content producer who we've been working with to get the website up and running. And we will again plot those links within the chat if people want to click on it now. And then also Alex Rochman, program administrator for YCCCH, who has helped us putting on this webinar today and helping us with Zoom registrations and things. So thank you. We also want to do a special thanks to Yanjia Lee, who's a second year public health candidate who worked with us earlier on in the semester, but due to unforeseen circumstances, was not able to present with us today. But her work within the template earlier on was very beneficial and helpful. So thank you, Lee, if you're here on the webinar today. And then lastly, our webinar attendees, thank you so much for being here. It really means a lot in terms of the work that we're doing and also making sure that it's getting out and disseminated properly with this version. So thank you, thank you. And I am just going to pass it on to Jen with the Q&A questions. We can probably start first with some of the questions that we've received via the registration link. And then any that are popping up in the group chat as well.
Yep, I put one in the chat. This was a pre-submitted question. What type of messaging / technology can municipalities possibly use to inform residents of extreme heat and impaired air quality?
Yeah, I can tackle this one as well. One, I would first like to plug in like with social media, like in the time that we're living in today. Social media is one thing that's, social media platforms in general are being used a lot, and it's at our fingertips. And so I think with reaching with social media platforms, it's the matter of who we're trying to reach, and also the audience and which groups are typically on certain social media platforms. So for example, if you want to reach vulnerable populations of older people or older groups, maybe they may not always be on Instagram. So you might want to post that alert maybe on like a Facebook. And then for younger folks as well, they may not be on Facebook, but posting that alert would be helpful on maybe Instagram or Twitter or something. So I think that using the power of social media in our advantage, especially for municipalities to use, is something to consider, and also how to use it effectively to reach the groups that you want to reach, because not everybody is on the same platforms. I will also say too, I know Jen was telling us about how municipalities, and you can correct me if I'm wrong, about a tool called Everbridge, used by municipalities in in the Connecticut area, that's currently used for like high emergency alerts. So I mean, I think it's a great conversation to bring up in terms of some tools that are already existing for municipalities and technologies, like um, what can they also post, including some of the infographics that we've gone over with the template. But great question. And I don't know if Senna wants to add on.
I think you covered it pretty well. Thank you.
Yeah, and definitely there's a sections in the toolkit itself that can help address this and examples that you all can use. Okay, so let's see. There's a few questions I want to get to from the chat and the Q&A, so I'm going to bundle two of them. And maybe you guys can address them together, or you can take one or the other. So Jana is asking, are there recommended response plans for local health other than messaging and cooling centers? And then kind of similar but slightly different question from Ruth is, this is an exciting new tool. Is there a role for community partners to help distribute and get the word out? And great work.
Yeah. I can start with these, and then Reese, if you have things to add, I will pass to you. But yeah, in terms of additional recommended response plans other than messaging and cooling centers, yeah, there are a bunch of other recommended responses, including like doing checks on folks who might be especially vulnerable to different emergencies. And it goes through each of like extreme heat and air quality, and both preparing beforehand, but then also during the emergencies. And within each of those kind of different activation phases, there are a bunch of recommended responses. So it does go, I would say, pretty far beyond cooling centers and messaging. So if you go onto the website and download the template, and you can go through those activation phases, and there are a bunch of additional recommendations in there. And then in terms of a role for community partners, yeah, I think definitely there is definitely a role to help distribute and get the word out. And one of the things that we did was to ensure that community partners were listed as like one of the folks that local health departments should be reaching out to as they're creating and really making this template specific to their own municipality. But I think especially, you know, community groups that might be working with specific communities and vulnerable populations and all of that will be really critical to collaborate with, to ensure that the folks that they're working with are getting this information, and also that concerns that they might have that are need to be like addressed ahead of time or added as like a preparation are included within the municipality specific response plan. But yeah, Reese and Jen, I don't know if you have additional things to add on that one.
Yeah, no, definitely piggybacking off of what you were saying, Senna, too, and also with the roles and responsibilities again, like Senna was saying, outlining that in the template was super important to us because our community partners have important roles. And I think also knowing that the roles between community partners and local like departments or municipality departments is that it's a two-way street too. So instead of community partners waiting on municipal leaders to reach out to them, I think it will also be important to identify who's your municipality like leaders in the area, and know how to, you know, like do that the opposite way of communicating the concerns that you're seeing like on the ground, and starting these conversations as well. So yeah.
The reason I group those questions is because I think it's so critical for community partners to help get the word out and to speak with their, local leaders, work with the health departments. One of the insights that came out of this other student group work that Reese and Senna have mentioned is that they found that working with people with severe mental illness, that their center is trusted as a resource for that population, whereas that population didn't have as much interaction with the health department, like New Haven Health Department, which is nothing against the health department and all of your work. It's just that it's those relationships and community trust can be so valuable in terms of bringing in community partners that have built those relationships. So a lot of it is around relationship building, and a lot of those preparatory steps we do really encourage that in terms of just getting people on board, getting people aware, and so that when there is an emergency that those relationships are in place, like you have somebody's number and they know who you are, and can help you do that kind of outreach. All right, so I'm not seeing any other questions in the chat, but please do feel free to continue. I'm going to pull up our list of pre-submitted questions again to see if we can knock out a few more of those. Let's see if I can, let me see. Okay, I'm going to group two again. Let's see how this goes. So there was a question about where to start in getting communities and services ready. And then a related question, but different, is what steps can be taken by municipal leaders and what steps can be originated/taken by communities? I think we addressed that a little bit earlier, but I'll see if you guys have anything else to add for those.
I can start, and then if that sounds good with you, Reese.
Yeah, that's fine. I couldn't get
Okay.
myself off mute, so go ahead.
Cool. Okay, yeah, so in terms of where to start with getting communities and services ready, I would really encourage folks to take a look at the template, because there are a bunch of recommendations in there about where to start with that and how to start really customizing this plan specifically to your municipality. But I would also encourage you to consider what activation activities that are listed within the template feel most relevant to your community, because obviously Connecticut has a lot of, we have cities, we have rural areas, we have a lot of kind of different areas. And so thinking through like what in there is most relevant to the needs of your community, I think is really important, especially at the beginning. And then also I think kind of going back to the question we were just talking about, like considering partners who you can work with, who have additional feedback on the most critical services to start with and most vulnerable populations, I think is a really important step there. And then kind of similarly, I think like there is a really big role for communities and for community groups to like encourage their local health departments and their municipalities to adopt extreme heat and air quality plans if they're not already working on that, to be more prepared for these events, and also to really specifically address the needs that local groups and residents might be seeing that that are really important to address immediately. And I think there are also some steps within the template that can be taken by individuals and community groups to kind of proactively prepare for extreme heat, even stuff around like making sure that your indoor air quality is better, so that when there are poor outdoor air quality events, you have somewhere safe to go. And working with neighbors to ensure that there's access to cooling centers and folks know where those are and that kind of work. But yeah, we'll pass over to you, Reese.
No, Cindy, you definitely said it very well. I was going to say the template. That's why it's created to use it as a tool that's also like proactive and not necessarily reactive in these events. And just to add on with like examples of like with I guess the second question that was lumped together, what steps can be taken by municipal leaders and what steps can be taken by communities. I think with the communities as point as well, first understanding who the community and the leaders of that community is key in terms of what Cindy was saying again about the vulnerable population. So, for example, are parents advocating for their children with asthma conditions, or are there landlords on buildings specifically for senior citizens who have some like concerns and need more information. And then where in that community are you located, which like municipality, and then reaching out to start those conversations and concerns with municipality leaders. So just echoing again what Cindy was saying. Yep.
I'll take this question really quickly. So Aisling was asking if the coalition, which is the Climate and Health Equity Coalition, is open to other local health departments joining. I believe so. I don't know if somebody needs to like sign off on it, but we are like, I think it's great if you're interested in joining. So I will just confirm and get back to you. Similarly with anyone else like nonprofits. I think the group is like large, but it's not like, I don't know that there needs to be any limit on it. But if anything, you're welcome to like join in terms of like just signing onto the meetings and like, you know, listening to the conversation. So I will follow up and just let you know if there's openings and how to join. And Hannah, thank you, Hannah. I was wondering if you were still on. Okay, great. So yeah, Hannah is the convener of the coalition, and she can hook you up. And then I wanted to just take one more question that was pre-submitted because the question is around funding. And the question was, what funding opportunities do you foresee around technology to optimize LHAQ plans? So the technology-focused funding, I actually don't know the answer. I know there have been grants around air quality monitoring, and also sort of hyper local heat monitoring is something that could, I don't know if that's the type of technology that this question asker was referring to. There is also through DEEP, there is a free sensor loan program that they will provide you with a Purple Air. It's kind of like a low cost air quality sensor, and it only measures PM 2.5, but it's a great indicator around air quality issues that can be used by community groups or municipalities. So that is available. If you Google DEEP Sensor Loan Program, you can work with the team there. And in terms of funding more broadly, like we all know that in the public sector, oftentimes funds are inadequate to do all that we want to do. And so frequently, you know, in the work that, you know, we do at Yale, at the state and local health departments, we were often trying to braid together or thinking creatively about how to apply for different grant mechanisms. And I would encourage thinking about different exposures and different health outcomes in different vulnerable populations to look at grant opportunities related to, for instance, health equity, for instance, related to elderly populations, like does your senior center, do they have access to certain grant opportunities that's dealing with older adults? In terms of people with disabilities or people with mental illness, are there grants that could kind of help serve those populations where you can weave in kind of like environmental and climate risks and sort of do that work for targeted vulnerable populations. There's also, in terms of populations with asthma, there's like the Healthy Homes program. There's other opportunities, I think, for just different like health issues. So I don't have any like specific, I certainly don't have any grant opportunities besides those pilot grants that I mentioned for this kind of planning, but that unfortunately the grant application closes on Monday. Yeah, so I think the people who are applying are applying and we'll be able to award those. But going forward, we will be in touch if we find out about any. But yeah, do kind of think creatively about how to protect certain populations in your community. And we have a few minutes left if anybody else wants to chime in, otherwise we can wrap up. Okay. Looks like we are all set here. So thank you, everyone. Yeah, really happy to see all of you and have a great rest of your day. Happy weekend.
Thank you so much, everyone, for joining us today.
Yeah, thank you all so much for coming.
Bye. Okay.